Hi, my name is Stephanie Swasey, and today I'm going to be talking about DMS-5 social phobia. According to Holly and Butcher 2017, DMS-5 are psychological disorders. Social phobia falls within one of those DMS-5. Galassi 2011 informs the diagnosis of social phobia can be done after examining behavior patterns like fear of writing in public, speaking in public, fear of eating in public, attending parties or other social occasions, or using public restrooms. These fears become a concern when they interfere with the daily life tasks. Holly and Butcher 2017. According to Holly and Butcher 2017, adults with social phobia perform poorly at work and are more likely to be unemployed. Romero 2021 shares how 12% of the population experience social phobia. It's more common on females than it is on males, and how for some, the recovery is spontaneously. But for those people that their recovery is not spontaneously, might need treatment. There's medication and therapy. According to Phobia 2014, there's a medication like antidepressants and anti-anxiety medications that can be used to treat social phobia. Phobia 2014 states how medication causes relapse if stopped taken by the patients. Phobia 2014 informs that therapy treatment for social phobia is more successful. Galassi 2011 shares how in therapy a person learns coping strategies for maladaptive behavior. The therapy first focuses on the goal the person would like to achieve. For example, the person could state, I would like to write in a public, I would like to speak in public, I would like to eat in public, I would like to attend a party, or I would like to use the public restroom. After the goals are set, Galassi 2011 follows the therapy with 6-step exposure plan. The first step is imaginal exposure. The person selects a goal, then visualizes what can be done in order to reach the goal. For example, if the goal is to read in public, the person visualizes in putting a bookmark. The book, then going to a public place. Then putting the book on their lap. At that point, the person could stop and relax or continue other steps. This part is important. Romero 2021 informs how gradual exposure to social phobia and therapies has shown to help overcome social phobia. The first step basically focuses on the importance of taking baby steps. And of course, not doing it in public yet. Doing it somewhere comfortable for the person could practice. The second step is real life exposure. In this step, the participant will put their imaginal exposure into practice. Galassi 2011 points out the importance of taking baby steps. For example, if the participant goal is to read books in public, the first step consists of putting a bookmark on the book, then going to a public place, then putting the book on their laps. Then the participant can stop and relax, or the participant can continue. For example, pick up the book, open it, then another step will be the participant can read a paragraph, and the participant continue to add steps until the goal is reached. So basically, the imaginary exposure is something that you've been practicing on step first. But on step first, you first did it somewhere not in public. Third step, is imaginal mistakes. According to Holly and Butcher, social anxiety leads a person with the concern that they might act in embarrassing way, which will cause humiliation. Colossi 2017 informs how humiliation isn't what others do to us, but what we do to ourselves, and how only our interpretations are of events. So basically, on step number 4, Colossi is it's informing on how in the importance of not feeling humiliated, because social phobia is they experience their actions with humiliation. So therefore, it is important to address mistakes. For example, taking the idea that wind made the bookmark fly away and landed in a puddle, or drop the bookmark came off and you lost your page. So at home, these are imaginary mistakes that could be happening. So the person has to be like, oh, this could happen, and basically prepare for it. So the 4th step is real life coping. It's basically putting imaginal mistakes into practice. So at this point, the person has already practiced at home, and they're taking the 4th step to a real life situation. 5th step is imaginal coping. In this step, Colossi 2011 focus on how it is important to remember mistakes can happen, and learning cope with them is important. So the next step is real life coping. Practice makes perfect. Learning how to cope helps anxiety levels drop. Colossi 2011. So basically this is important because you want to do steps little by little. And remember that if something happens, you need to not feel humiliation. You need to think, okay, well, this happened, what can I do about it, or just continue. In conclusion, Colossi informs how these steps are gradual and will help a person graduate with skills that can be applied naturally to overcome social phobia. Romero 2021 informed how therapy procedures substantially improve and medication need to be taken for a long period in order to prevent relapse. So basically, it is important to take that into consideration, how therapy is going to help you little by little, and you're not going to have to depend on medicine, which the medicine is not really helping you to cope. So if you stop taking the medicine, you're going to relapse. But if you learn how to take therapy, you're going to be able to master your social phobia. Moving to psychological causal factors can help us further understand social phobia. There are different psychological causal factors. One is social phobia as a learned behavior. Csudh 2019 informs how current research concluded how adults with social phobia experience bullying victimization during their elementary years. Another way to further understand our understanding of social phobia is that understanding social phobia can be a biological causal factor. Can also help understand social phobia. According to Psychology Today, social phobia appears to be passed down. Research informs how social phobia has a genetic contribution. Also, people with social phobia, in order to reduce their anxiety, use alcohol. According to Holly and Butcher 2017, research with a high amount of participants show a high rate of comorbidity between social anxiety disorder and alcohol use disorder. Research informs that people use alcohol in order to avoid the social anxiety experiencing in social situations. Holly and Butcher, 2017. So in conclusion, social phobia, it is a psychological disorder, and it could be diagnosed by the person's patterns. For example, if the person's afraid of writing in public, eating, they're experiencing social phobia, and it's important to help them because that could interfere with their lives. And people are shown not to have jobs, which not having a job can be very harmful. Therefore, some people can recover spontaneously, but some don't. So therefore, there's medication treatment and also therapy treatment, but the outcomes are different. If you do medication, you might be exposed to a relapse if you stop taking the medication. As for therapy, it's just gradual exposure, little by little, and the gradual exposure is gonna teach you coping, and it's also gonna help with humiliation, understanding what is humiliation. And another important factor is understanding casual factors. There's a lot of casual factors, but one that was interesting to me is how if a child experiences bullying at a young age, later on in life they could develop social phobia. And then another interesting point was how biological casual factors can also help understand social phobia. So therefore, just the fact that research informs that social phobia is has a genetic contribution. And finally, going back to also how if those people are consuming a lot of alcohol, in order to help them to stop drinking alcohol, we could see if they're suffering from social phobia, and that's why they're drinking. So in order to help them to stop drinking, in order to help them stop drinking, we need to help them with their social phobia. So reducing social phobia could also reduce drinking. Thank you.